Our profession can do better, and I think it needs to do better when it comes to communicating with patients. The word doctor, believe it or not, it actually comes from the word teacher. And I think we need to remember this. I think that as a profession, we need to try to listen more and explain things in clear, easy to understand terms. Our job can be stressful, and there are often time constraints. But I think effective communication is important, and I think it needs to be a priority.
My first impression of Dr. Atkinson was wonderful. He was very knowledgeable. I asked questions about his background. As I said, I was terrified of going in, and he was a doctor I didn't know. So his background was very knowledgeable. I was very impressed. And his personality, he put me at ease immediately, answered every question I had, very understanding about why I didn't want to go into surgery again, and was very understanding about proceeding through other avenues and not going right into surgery. And then was very understanding when I had to go into surgery about putting me at ease about having to go into surgery. His staff was also very understanding, answering any questions I had, even calling me to make sure everything was okay after surgery, which was, I was shocked. And even Dr. Atkinson called me to make sure everything was okay after surgery. That was a first in my life, and I'm going to be 53. I've never had a doctor call me to see if I was okay after surgery. And I was very impressed that he was that concerned that was I okay. I mean, to follow up, that personal touch of following up and making sure everything's okay, and was I doing the physical therapy? Did it feel like it was breaking my arm still after surgery? And I said, absolutely not, because they put me in physical therapy immediately after surgery. Definitely go see Dr. Atkinson, because he will review everything, the situation, and he will, with patients, explain everything to them and lead them on the correct course that they need for medical care.